Okay.
Thank you, Lemuria. Welcome, colleagues and Council Foxworth and members of the general public. This is the Health Occupation Subcommittee of the Education, Health, and Environmental Affairs Committee. We were delegated 3 bills last week. We have dispensed, bad puns, sorry, dispensed with one of them, but we have 2 more on our agenda for today. We have been collecting information and connecting with key stakeholders, and we are going to start off with Senate Bill 34, State Board of Physicians Genetic Counselors Licensing. And with that, Ms. Foxworth, do you want to start us off? And
Sure.
give the overview, then we'll toss it to Senator Lamb.
All right. So in general, Senate Bill 34 deals with the licensure of genetic counselors by a particular date. So the Board of Physicians will oversee it, and genetic counselors will be required to be licensed by October 1st, 2023. This particular bill deals with licensure, issuance, certification, waiver of certification requirements, renewal, and discipline. There's a sunset review, so the provisions of said bill will expire July 1st of 2031. There are a couple of amendments. So we have amendments by Senator Lamb, and we have some amendments that have been submitted by the Board of Physicians.
And they did meet their deadline of Thursday.
And yes, that deadline was met.
Great, thank you.
So I'm not sure, I don't see Matthew from the Board of Physicians up here, but it could possibly be helpful to hear his perspective on those amendments. I'm in possession of a summary of Senator Lamb's amendments and Mr. Dudzik's amendments.
Do we know whether they have the link so that we can hear from them and they can make their case?
If not, I can go ahead and forward it to him real quick.
Okay.
So Senator Kagan, did you, I'm sorry, did you want, was that Matt from BOP to participate?
Dudzik, yes, as he did last week, but
Okay.
I just emailed it to him, Lemuria.
you just said you forwarded it to them.
Oh, he has it, Alexis?
Yes.
He does, okay, all right.
All right, so hopefully let's give them a moment. Why don't you, while we're waiting for them to get it, because I'm sure they were aware of the timing and therefore sort of eager to get on, why don't you share with the committee, if you could, the general overview of their, here we go, okay, good, of what they proposed, and then where Senator Lamb and his thoughts, and obviously do that yourself. Matthews, thank you so much. Sorry we didn't get you the link in advance, but we're very glad you're here. Thank you.
Thank you.
Thank you for getting your suggested amendments in on time last Thursday. That allowed our council to work with it. So really appreciate that.
Certainly. And thank you, of course, also to Senator Lamb's office for working with us so well. We've been in discussion with the office for some time, so we'd had a lot of these kind of in the works, but needed to finalize them, and I appreciate the committee's extra time provided. Just as a brief summary, they
right, Matthew, I'm just going to interrupt for 1 second. I want to make sure colleagues, you all have the copies of both Senator Lamb's amendment and the Board of Physicians amendments as he describes them. And if not, I'm happy to forward them to you again to make that easier. I think I'll do that. I'm just going to assume that it might not be top of your inbox. Go ahead, Matthew, please continue.
We sought to address some of the concerns that the Board of Physicians had in a way that would not be overly restrictive for the stakeholders of the bill. So regarding the year-long licensure exemption that was proposed in the bill, we proposed a supervised genetic counselor license that would allow individuals that met all requirements for licensure, with the exception of the passing the certification examination to become licensed, and kind of goes over that process at the year-long license. The other main issue that we brought up was the timeline. We did put in a request for a delay of implementation to by a 3-month delay. So from October 1st of this year for the start date, and then October 1st of 2023 for the date when licensure is required, we would bump that back 3 months. So to January 1st of 2022 and January 1st of 2024.
The reason for that, Matthew, can you just give us some justification on each of those?
Certainly. So the reason for the delay, we are a special funded agency, so we are entirely reliant on licensing fees to maintain our fund balance, which has put us in a very tenuous position since the start of the governor's executive order that suspended licensing fees during the state of emergency. And again, we've been very, very lucky. A lot of our licensees have chosen to pay their licensing fees, even though they are not required to. But it means that we actually have no way of knowing how much revenue we're taking in any given year. And until that state of emergency ends, we are kind of left in this very open-ended position. It's also, this is more of a, this isn't something that we went into too much in our testimony, but another issue that the Board of Physicians has right now is that the majority of our licensees renew on odd year cycles, which means that we take in significantly more money on odd years, and we actually lose money on even years.
Okay, so Matthew, I'm just gonna, do you prefer Matthew or Matt, by the way?
Both are fine. Matthew is fine. Thank you.
Okay, so let's just pause on the 3-month delay. Senator Lamb, are you copacetic with that? Can you live with a 3-month delay for the reasons that Mr. Dudzik just laid out?
Yeah, I think we can live with that. That's a delayed implementation until January 2022, and a delay in the requirement that all genetic counselors be licensed until January 2024. Right.
Colleagues, does anyone object to that? Okay, so Matthew, you won one for your team here. Okay, let's keep going.
Yeah, the other one that I mentioned was the addition of the supervised genetic counselor license. This was a pretty major sticking point between the parties, and again, I do want to thank Senator Lamb for working with us for such a prolonged time to find a solution that would work. This essentially creates a second licensure category. It eliminates the major concern we had, which is that the exemption for licensure for recent graduates would mean that individuals that were not licensed by us may be allowed to practice for up to a year, even though they did not meet the qualifications for licensure.
And Matthew, you're talking about number 2 in your memo, right?
Yes, and I apologize because I actually I know that Alexis wrote up or distributed the versions that the Senator's office and the Board of Physicians agreed on. I don't have that right up, so I just have our notes. So I apologize if anything I bring up is out of order.
No. So maybe Ms. Foxworth, would you be able to forward it to Matthew, because I don't have his email? But if you can forward to him what we're working off of, so we're all literally on the same page.
Is what Ms. Foxwell is sending the actual amendment language? Because what Senator Kagan just forwarded to us it's like a Word document that I think outlines it, but it's not the actual language, nor the other one is also not actual amendment language. So is there actual amendment language somewhere?
So there's not actual amendment language at this point. So we have the summary and the overview, since the plan was to draft one from the committee and for us to kind of compare both of you all's and to decide from there.
Right.
So
it didn't make sense to take a lot of Ms. Foxworth's time to do it twice if the subcommittee was going to go in a different direction. So, but if you do scroll down, there's some blank space in Mr. Dudzik's testimony. But if you scroll down, you'll see that there is more verbiage there. So let's talk about Amendment number 2. We'll save number 1 because we know that we've got a difference of opinion there. We've done amendment number 3. And Ms. Foxworth, excuse me, please correct me if I do any of this wrong or in an order that makes no sense.
Okay.
But can everybody get to amendment number 2, remove licensure exemption for recent graduates and replace with licensure of genetic counselor trainees?
And I will say that we had some additional discussion with the Senator's office. And one of the things that we agreed upon was to actually call it a supervised genetic counselor license. So we would no longer be using the term genetic counselor training. Supervised.
What term, Matthew? I missed it.
Supervised genetic counselors.
Okay.
So this would be a limited license for 1 year. It would be for individuals that met all requirements for licensure with the exception of taking the examination, and they would be required to work under supervision. It would allow us to go through the checks and safeguards that happen during the licensure process, but still meet the issues that the Senator and the stakeholders raised, which is that the examination is only done twice a year, and there were concerns that individuals who went to school at one of the schools that offers a degree for genetic counselors would end up going to other states because they wouldn't be able to do this in that period.
Okay. Colleagues, thoughts on that? Senator Lamb, we can go to you first or last. What's your preference?
Yeah, we already worked this out. We're fine with that.
You're fine with that. Okay, colleagues, any concerns about amendment number 2? That seems like a good public health oversight thing. So thank you, Senator Lamb. Thank you, Mr. Dudzik. Okay, amendment number 4. Is that an obvious next one? Replace 30-day exemption for out-of-state licensees with consultation.
So this is actually we expanded upon amendment language that Senator Lamb's office initially offered. When we brought up this issue, the stakeholders stated that the reason they wanted an exemption for out-of-state licensees was because there were frequently cases where there were experts on certain rare diseases or genetic disorders, and a hospital or facility might wish to consult with them. Senator Lamb's office introduced an amendment on their proposed amendments that got most of the way there, which was to allow for an exemption for out-of-state licensees to consult as long as they did not direct patient care. We asked for 2 changes to that. Our reasoning being that directing patient care is not within the scope of practice for a genetic counselor regardless. So we clarified language that they were not ordering specific genetic tests. And then we also added a restriction that they could not perform that more than 10 times in a year.
Colleagues, Senator Lamb.
Yeah, I think we worked out this one too. We're fine with that.
Okay, colleagues, any other concerns or, yes, Senator Hester?
I'm just not being a doctor myself. I'm trying to understand what consult versus practice means. And does this go enough to the intent of the bill to allow the patient counselor relationship to continue if it's only in the consulting area?
It does. And I think the genetic counselors are comfortable with this. Practicing while it's colloquially people use it to mean whatever, but I guess legally regulatory wise, it means it's really referring to something that a provider has to do. So provider being a physician, a nurse practitioner, or a physician's assistant. So they can consult with a provider, but they're not actually practicing, so to speak, in that way.
Is it worth clarifying whether they're okay with it?
Yeah, we checked. They're fine with it.
Okay, Senator Ellis, you had a question, I believe?
Yeah, thank you, Madam Vice Chair. Yeah, my question is, Matthew mentioned out-of-state counselors who consult. So they're limited for his proposal for 10 consultations per year. And if this person is really good, we don't have the expertise in Maryland. So what's the next step? Can they do additional consultations? And if so, under what situations, criteria, rules can they do the 11th and beyond consultation?
Sure. Thank you for that question. So this would not in any way be a replacement for licensure. And we actually, with a lot of our health practitioners, out-of-state health practitioners that regularly provide services, whether it's consultation or telehealth services or anything of that nature, have the ability to become licensed in Maryland. So our thoughts are that if they are regularly providing these consultation services, they can take that next step and become an actual Maryland licensee, which would fully allow them to practice and provide in the state of Maryland. But if it's the case where it's just an expert who occasionally needs to be consulted, it's not really worth it for them to obtain a Maryland license. We wanted to still allow that to occur.
Okay, thank you for the explanation. So this expert who is called on more than 10 times in Maryland, they see their frequency of their services in Maryland. Can they get their license on the proposal through reciprocity, or is that a seamless process currently, or in the future?
It is a fairly seamless process. The Board of Physicians has taken a lot of steps to make that cross-state barrier easy to and seamless as possible. So we've had things like the interstate licensure. That's for physicians and physician assistants. But if they meet the qualifications for licensure, they should, if they're a licensed genetic counselor in another state, as those qualifications are pretty similar across the board, they can apply for licensure. There's no requirement that they must reside or actively practice in.
Okay, great. Thank you for clarifying that for me.
Senator Hester, you have another quick question?
I think I'm all set. Thank you very much.
Okay. Okay, so we are, and just to be clear, colleagues, we are going to be getting, Senator Lamb has some other amendments, and I am not in any way, looking to prioritize. I just, okay.
I think we're on agreement with almost all the things that Mr. Dudzik had said. I think there's just one point that we're still trying to work out. Which
Amendment number 1. Okay. So, do you want to go fast then, Senator Lamb? Amendment number 5, number 6A and 6B, 6C. Why don't we just? I
think the main one is the structure of the advisory board, which I think is Amendment 1.
Yes, that's why I said. So can we just knock out 5 and 6? Does anyone have questions or concerns about 5 or 6? Mr. Dudzik, why don't you do 5 briefly, 6 ABC, and then if there's consensus on those, we can just go fast and shift to number 1.
So Amendment 5 was to address.
Sorry, I'm just trying to orient myself. Did we switch from the Word document to the PDF?
We're in the same document as been in the PDF.
Okay.
We're scrolling down. I'm on page 5 of 8 with amendment number 5. Remove board ability to waive certification requirements.
Okay, so we haven't gone on to the Lamb amendments yet.
Not yet. Nope.
Got it. Thank you.
Finish the
Sorry.
Dudzik amendments, and then we'll go back to number 1, which is where we have a difference of opinions. But okay, Mr. Dudzik, amendment number 5, briefly.
Thank you. And in my document, we actually agreed to a fairly substantial change to what was listed in the document that I originally submitted. So I'm going to speak to that change rather than our original proposed amendment. So there was language in the bill that gave the board the discretion to waive educational or certification requirements. The board had concern with that. It's not something we can do for any other profession. We would prefer that the qualifications are set in stone. We don't want to open ourselves up to litigation because we did or did not exercise that discretion in certain cases. So we did oppose that language. We had some further discussions, and an agreement that we came to was to instead add essentially grandfathering language. So if individuals had been practicing in the state of Maryland as a genetic counselor with, I believe it's 10 years of experience, at least 5 of them must be the 5 preceding years, and met the educational requirements, they would be able to pursue licensure even though they hadn't met the certification requirements. requirements. This was to address longtime practicing genetic counselors who for whatever reason have not gone through the specific certification process, but have, again, a decade of experience providing these services. And it is a limited grandfathering clause. It would be valid through 1 year after that January 1st, 2024 date. So I believe December 31st, 2024 was the final date on that. So they would have until that point to grandfather, and then after that, that window wouldn't reveal.
So clarifying, Mr. Dudzik, after saying that this was unique among all of the other professions that you currently license and a fear of lawsuits, you are, despite those two things, you are now okay with this language with Amendment 5, and Senator Lamb is as well.
Yes,
Yeah, I'm okay
so
with this.
yeah, it's because it takes away the discretion. There's no fear of litigation because of how the board exercised its discretion. So if there are clear-cut circumstances that are spelled out under which somebody can apply for this licensure exemption or the certification exemption rather, because they would still of course have to be licensed, that takes away that risk for the board. So yes, we are okay with that.
Okay, and Senator Lamb is as well. Colleagues, other colleagues, any questions, concerns about amendment number 5? Seeing none, let's shift to amendment number 6, which goes into A, B, and C. Matthew, do you want to talk about this one?
Yeah, this should be fairly brief. These are just changes. They're changes that occur within the disciplinary grounds that are mostly made for consistency's sake. So one of them was new language that was introduced pursuant to the 2020 sunset. So it hadn't made it into the original bill. Another was a disciplinary ground that's specific to the prescribing and administering of medication, which is of course outside the scope of a genetic counselor. Felt it was extraneous to leave it in. And then the other is the gross overutilization of healthcare services. Again, that's a common ground that is found in the disciplinary grounds of the other health professions. Wanted it included here as well for consistency's sake.
Okay, and Senator Lamb?
Yep, we're fine with that.
Okay, colleagues, any questions or concerns about number 6? Okay, well, this is going swimmingly, so props to you both. So let's go back. Senator Lamb, do we start with amendment number 1, or do you want us to shift to yours?
So just the two documents are kind of
Team partner.
working off of each other. So the Word document is nothing. I don't think we need to look at it anymore because it's kind of a working document off of what was in the PDF already. So really, the only outstanding piece is just Amendment 1. In the consideration of that. I think everything else has been already addressed as part of the discussion up to this point. Everything else in the Word document.
So what I'd propose then is Mr. Dudzik lay out your position on amendment number 1. Senator Lamb, lay out your position, and then we can have a conversation and then vote.
Thank you. So amendment number 1 refers to the makeup of the Genetic Counselor Advisory Committee. With all other 11 allied health practitioners that are licensed under the board, we have a specific makeup where it is an equal number of practitioner members and physician members. And there is a requirement that physician members must also have specific experience with the profession in question, the profession that's being regulated, and then a consumer member, which brings it up to an odd number. So the original proposal had an even number. It was 4 genetic counselors, 3 physician members, and one consumer member. Senator Lamb's initial amendment dropped that down to 2 physician members, which of course got rid of the issue with the even number, but still left it so that there was a lack of balance. So this is something that the board feels pretty strongly about. This is the makeup that we have used for all of our other committees. While certainly anything that comes out of committee still needs to be approved by the board. It is very important to us. The committees do a lot of vital work, especially in the case of promulgating regulations. And so, the board, of course, relies very heavily on those committees to have everything worked out properly before it even comes to the board, especially, again, when you're dealing with something like regulations where there are very set deadlines and something being bounced back to the committee could end up delaying something until the following year.
So I think there's a way to split the baby in this, and I think this is, so what I'm going to propose is Mr. Dudzik's proposing 3 genetic counselors and 3 physicians and then 1 consumer member. That's a total of 7. That gives you the odd number that you want so that there's not a deadlock. And then
could you just go through that again, Senator Lamb? I'm sorry.
yeah, sure. So it's
3
so
genetic counselors, okay,
3 physicians, 1 consumer member. I think most of these advisory committees also have a consumer member. So that gives you the 7.
Okay, thanks.
So there's no deadlock, there's no tie. What I think that the genetic counselors are worried that, regs can be suggested to the board and taken up without at least some input from a genetic counselor. And so what they're proposing is that there be a requirement for a quorum of at least 5 of those members to be present. So that way, you can't just have 3 of the physicians, 1 of the consumers present. That gives you a majority to hold your meeting, and then just to push through regulations without the input of at least 1 genetic counselor. So, I think they're comfortable with the fact that if we come up with, a quorum requirement of 5, that would at least make sure that the genetic counselors have some ability to weigh in on that. So that still keeps the composition, still keeps, 3 physicians, 3 genetic counselors, but just sets a quorum requirement of 5.
Is that a motion, Senator Lamb?
Sure.
Okay, or do you want to, yeah, so let's have that on the floor and officially discuss it. Is there a second to that motion for purposes of conversation? Senator Ellis? Okay, conversation, colleagues?
Yeah, I have a question on that. So if you have a quorum of 5 and they vote on something, they'd only need 3 of those 5 to pass it, correct? And they wouldn't need 4 votes because it's actually the whole board is 7. I'm not familiar with that board. So you understand what I'm saying?
I'm guessing they need a majority of those present. So, yeah.
Okay, I've just.
So you still could have the 3 physicians vote in one way, and then the 1 genetic counselor and the 1 consumer vote the other way. And
it's basically raising the quorum. The quorum, I guess, would be 4 because the majority of the board now is just bumping up 1 to 5, correct?
Right. The quorum would be 5. So at least a genetic counselor would be present, be there to weigh in.
Right.
I'm fine with that.
The 3 physicians and 1 member of the general public would not be able to prevail or, I don't know.
Well, hopefully I don't know how these meetings are, the notices are that they're scheduling a meeting. I'd like to think that hopefully all 7 could be, available. This is, at a time when they, that possibly scheduling conflicts or whatever, and you have to have a meeting. But I would think, I don't know how they schedule out the meetings, but I would assume there's pretty decent notice prior to.
Yeah, usually I assume, having been to some of these meetings, not this one, but usually there's some notice, and usually they're at some regular interval, right? So it's like quarterly or every other month or every month or something like that. So they're on some interval.
Right. So it's not like they're trying to pop up a meeting out of the blue and a couple might not know about. These are, publicized meetings and know ahead of time. So, this seems pretty reasonable to me, honestly.
Anyone else?
Yes, I
Is there
have a
comments?
question.
Yes.
Madam Chair, thank you. So question that might have a follow-up to Matthew. How many different professions are regulated by the Board of Physicians? Is it just physicians?
No, currently it's physicians, and then there are 11 other allied health practitioners that are also regulated under the board.
Okay, what are those other professions?
Ooh, this, let's see if I can list them all.
Well, it doesn't have to be all comprehensive.
Sure. It's physician assistants, radiographers, radiology assistants, athletic trainers, naturopathic doctors, perfusionists. I'm of course already kind of going
Okay,
blank,
well, yeah.
even though I deal with them regularly. But
Yeah,
yeah,
I got the idea. Thank you. So my question is, Senator Lamb, why would we limit the board just to physicians and genetic counselors and then one member? Why not have a broad swath of folks who are regulated by this board sit in on this? I mean, why would we just have 2 of the 11?
Because I think it's a good question. I think there are different advisory committees that sit under the board, and these advisory committees are usually for a specific type of provider, right? So there's like the naturopathic providers. So these advisory committees are usually composed of the folks that are actually under specialization and these physician members. So I think that's kind of the general composition of it. In this instance, we just want to make sure that what the amendment does is really allow that there be equal representation of physicians and genetic counselors because they work very closely together, right? Genetic counselors can't, just to Senator Hester's earlier point, can't practice on their own per se. They have to work with a provider, and so that would most commonly be a physician. So that's the other reason why we're kind of marrying these two together.
Yeah, but when they're licensed, they have the right to work on their own. That's why, they're being recognized that way, right? Or do they always have to be affiliated with a physician? Is there, did I miss something with that?
I think, was that a question for me or for Ms.
Yes,
Person?
well, sure. Whoever can answer that.
I think the reality is that they're almost always working with another physician, because a lot of these tests that they have to order are tests that the physician actually has to put orders in for. So for all of these genetic kind of testing, the doctor actually, or an NP or a PA, has to put the order in, and then the result comes back. The doctor is aware of those results, but they would work closely with the genetic counselor to actually do the counseling with that patient. Technically, I think they can practice alone, but the reality is that they have to work very closely together for things like the diagnostic tests and whatnot.
Right. So you mentioned that they can get a referral from a nurse practitioner. I guess that's the NP, right? And
right.
And or a physician assistant, PA.
Right.
So it doesn't have to be a MD that give the referral. Right. Yeah. So why not have some of those folks on the board also? Like an NP, one NP, one PA, and stuff like that, to get a broad representation.
I think it's because most often they work with physicians. Some of these conditions are pretty rare and pretty unusual. Most of the other kind of allied health providers like PAs and NPs are usually dealing with more of the routine type of cases. So that's why usually the more complex cases get bumped up to the physician to handle. Okay. So these types of cases, I think, will most often be that way.
Okay, I thought as much, but since you're the expert, resident expert, I just wanted to hear how you articulate that. So thank you for that. I appreciate it.
Sure.
So colleagues, do we have the information that we need in order to vote, or are there additional questions? Oh, Senator Hester, your hand is up. I apologize. Mm-hmm.
Thank you. I was just curious, just for my own edification, either of you answer how the other boards are structured? Like, is this 3-3-1 like typical of the other boards?
Yes, I can answer that. That is fairly typical for the other boards. There are a couple of, the only cases where there are differences are boards. We have a couple of advisory committees that roll multiple professions in together. In particular, the ones that deal with radiography and radiologist assistants, et cetera. And in that case, it's still an equal representation, but because it covers 3 professions, it's 1 of each and then 3 physicians. But yes, typically it is an equal number of physicians and the allied health practitioner with a consumer member.
Perfect. Thank you.
Okay, other questions? Senator Hester, I assume that's an old hands up here. Can take that down. Okay. All right, colleagues, are we ready to vote? We have an amendment from Senator Lamb to the proposal from Mr. Dudzik for 3, 3, and 1, but requiring a 5-person quorum in order to take action. All those in favor of that amendment, raise your hand. Okay, that is unanimous. Thank you. Kudos to you, Senator Lamb, and to Mr. Dudzik. I think that's great collaboration that I think is going to be in good public interest. Senator Lamb,
Thank you.
are there issues that you want to raise on this issue or on this bill?
No, I think we resolved all of them.
I
Thank
think so too. Well, nicely done. So can we get a motion, please, on the subcommittee recommendation to the full committee on Senate Bill 34? Senator Lamb, would you like to move the bill? Okay, second. Senator Gallion seconds. All those in favor of the bill as amended, please raise your hand. And all hands are up, so that bill is unanimously recommended to, as amended, to the full committee. Ms. Foxworth has a few questions on what a friend taught me could be called grandparent rather than grandfather section, and so that she will be expect Mr. Dudzik and Senator Lamb and anyone else expect some follow up on that. So with that, Mr. Dudzik, thank you very much for your time. You're welcome to stick around if you like, but we will pivot now to the other bill. We've got we have Patricia O'Connor, who is joining us. And Ms. Foxworth, why don't you kick off this section, and then we'll have Ms. O'Connor present her testimony.
Sure. So SB 84 deals with maintenance injectable medications, and this is the one that we adopted out but brought back in on the virtue of receiving another amendment through Office of the Attorney General Education and Health Unit. Sorry, Mrs. O'Connor, if I am not appropriating that title correctly. But SB 84 expands the practice of pharmacy to administer maintenance injectable medications. And we talked about this. Senator Kagan said I just talk through the new amendments. Okay, so
Yep.
so I think we resolved most of this last week. So I'll just give an overview of what the new amendment does. So this amendment was requested by OAG, Health Education Advocacy, and it was adopted by Senator Lamb for the purposes of having a name sponsor. But I should note that these were requested specifically by OAG. These amendments
Office of Attorney General.
Office of Attorney General, thank you.
We try not to do too many acronyms.
Yeah,
So thank you.
Thanks, Senator Kagan.
Mm-hmm.
So these amendments would prohibit a pharmacist from administering a particular injection unless notice is given in the format of a particular form template. So if there are out-of-pocket costs that a patient has to incur, there has to be notice given in a form that's signed. So if a pharmacist is charging these out-of-pocket costs and fees, they can't collect the fee unless notice is given. The amendment would outline the form requirements that must be adhered to. The form must include notice that the pharmacist charges a fee for administration of the maintenance injectable medication separate from the cost of medication. It has to indicate the fee amount. It has to provide notice that the patient may have to cover the balance of the fee if insurance does not. The form has 3 options that must be checked: whether the plan covers the fee, whether the plan does not cover the fee, and whether the pharmacist has a contract with the patient's plan, or whether they don't have a contract with the patient's plan. It indicates, or it must indicate, the payment that's required, and informed consent must be given. And so just in general, it requires notice for those individuals who will not be given this medication for free.
Ms. O'Connor, would you like to add anything to Ms. Foxworth's explanation?
I believe it was accurate and fulsome. I'll be happy to answer questions. Unless you'd like me to repeat, but perhaps questions would be more fruitful.
Are there questions for Ms. O'Connor? Ms. O'Connor, do you want to officially introduce yourself for our colleagues and for anyone who's watching?
Thank you very much. I'm Pat O'Connor. I'm the Deputy Director of the Health Education Advocacy Unit, which is in the Office of the Attorney General's Consumer Protection Division. And these are patient protection amendments that are essential because there is not a coverage mandate for this service in the bill.
Okay, so are there questions about this amendment? Ms. Foxworth, do we all have copies? I know that I saw it. Does everyone else on the committee have this proposed amendment?
I'm muted and I was just talking. So if we refer back to the voting packet from last week, they'll be in our last week's voting packet, and I can forward those if necessary. And it's worth noting that the two amendments that we adopted last week in subcommittee, these aren't separate and distinct from the Office of the Attorney General's amendments can work in tandem with the two that we adopted, which were technical in part, and then the other allowed a maintenance injectable medication to treat sexually transmitted diseases. So these aren't distinct from, but they work in tandem.
Questions for Ms. O'Connor or Ms. Foxworth? So I'll speak. I'm just speaking as one senator and not as the chair. This seemed like good consumer protection, and I am grateful for your leadership and speaking out and bringing this to our attention, Ms. O'Connor. So I support the amendment, and I don't think it otherwise changes the bill. So I will make the motion that we take the consumer protection amendment at the advice of the Office of the Attorney General. Is there a second? Senator Ellis seconds. Senator Lamb is back. Senator Lamb, are you back because you have questions or comments or because you want to vote? And he is muted. Okay, are there questions or debate on the Attorney General's recommended amendment, which will be in our voting packets? Seeing none, can we vote? If all those in favor of the Attorney General's Consumer Protection Amendment, please raise your hands. I see 4 hands, and Senator Lamb is muted, but he is with us. So if he wants to be considered, since it will not change the voting outcome, he can contact Ms. Stanton afterwards. But that is 4-0 with 1, for now, abstention. Ms. O'Connor, thank you. Is there anything else you have for us on this bill?
Thank you very much. No.
Thank you very much as well. Ms. Foxworth, do we need to, we don't need to vote again on the bill, right? Are we good, or should we, for protocol reasons or parliamentary reasons, do we need to vote on the bill again?
I think that's a discretionary call. I don't think that's necessary.
I think we're good. Okay, then let's move on. Thank you, Ms. O'Connor. You are welcome.
Thank you.
Or leave. Take care.
You too. Thank you so much.
Thank you. And now that brings us to Senate Bill 183. Ms. Foxworth, will we have any outside advocates who will be joining us for this conversation? And either way, why don't you kick us off?
Okay, no outside advocates on this one. I do wonder if folks will be interested in joining when we vote as a full committee, because there were quite a few questions on this one that experts may be able to lend more expertise on, who have done it for quite a while. But SB 183 is the bill that facilitates the creation of an interstate compact for audiologists and speech language pathologists. It establishes those requirements, mainly educational requirements for audiologist members and speech language pathologist members that want to enter into the compact. It establishes privileges to practice and how that privilege may be removed, establishes the requirements that have to be met to enter. It establishes an audiologist and speech language pathology compact commission as well. Deals with jurisdiction based off of home state and member states, and whether home states can be punitive in regards to a licensee, and whether member states can be punitive towards a licensee. There are a couple of amendments that we have, and there aren't any new amendments that we've gotten since last time. But under the amendment that I'm in receipt of, the clinical experience requirements are to be, so the requirement to enter the compact, one of those is clinical experience. So as opposed to the Audiology and Speech Language Pathology Compact Commission overseeing this clinical experience, it will be a licensing board that will handle that. This will require the home state to be changed through an application for licensure. And that's the only way a home state can change it, can change their home state designation is through a new application. Adverse actions requirements, the member state as opposed to the home state can recover the cost of investigations and any investigations that have to happen in terms of discipline and adverse action. It is the member state now as opposed to the home state that handles that. And that's oh, the member state is permitted to recover the cost of obligations, not mandated to recover the cost of obligations. Sorry, can't understand my handwriting sometimes. So that's all we have on SB 183, the Interstate Compact. It is to be noted that when the boards enter into these interstate compacts, there's not a lot of flexibility. I know Senator Hester, you had a question on amending. Any amendments that have to happen have to be affirmed based off of the broader board, and it has to be approved by every state that enters the compact. So it operates kind of as a contract. So any change that has to happen has to have the consent of all of the other members. So if we are to adopt any amendments in addition to the ones that I've just explained, they would have to be approved through that larger agency so that the entire scheme isn't negatively affected.
So, yes, Senator Hester, give me 1 sec. I just have one question. Ms. Foxworth, I know that you and I spoke about how this language is similar to or different from other entities like this. Were you able to get some of that, and might you be able to share that with us?
Okay, sure. So SB 139 deals with occupational therapists, and for the most part, they're similar. There are some differences in terms of definitions. Honing in on the member state versus home state, I haven't done a comparative analysis of that discipline, and I'm not sure how important that is. But for the most part, they are overwhelmingly similar. The commissions, the licensing, the requirements to enter the compacts, the membership of those compacts, most of those are the same. And I can put together maybe like a comparative slide when we vote in full committee, if that's helpful. I think we'll probably vote both of those bills at the same time. But there aren't large differences in between the two of those.
Okay. Senator Hester, followed by Senator Ellis.
That was actually my question. I'm good.
Oh, all right. Great minds. Senator Ellis.
Less of mine. Here we go.
Sorry.
So how many states are in the compact presently?
That's a good question. Let me pull that up. It should at least be 10, Senator Ellis, and I want to find the full names of each of the states.
Are they mostly adjacent? Are they roughly mid-Atlantic, or are they all over the place?
Yeah, I don't think there was any, distinction or continuity or similarity between them
Okay, I mean, you can
in
have
terms
that.
of jurisdiction.
Yeah, you can have that for us during voting.
Okay, I can do
And,
that.
thank. And another question, if you could refresh my memory with the distinction between member state and home state.
Sure, so let me pull that up. So a member state is a particular state that enters the compact, but doesn't create the initial license. And the home state, so through the lens of the individual of a licensee, the home state is the state where the person has the license, and the member state also has authority over that licensee, but they didn't grant the particular license to them.
Okay.
Does that make sense, Senator Ellis?
So the member state is where the licensee is licensed reside.
Well, the home state, so it's member state, home state, and remote state.
Right.
Home state is where they reside, likely where they were licensed. Member state is any state that has enacted this particular compact. So those are the states that I'm gonna have and will have on hand for voting. And they also have the responsibility for discipline, adverse actions, et cetera, over that licensee. They have jurisdiction over the licensee who is.
Right.
Yep.
Okay, and you dropped another term, remote state. So,
remote state, yeah, I need to remind myself of that one too. Okay, so simply the remote state is any state where they're practicing but they don't reside.
Okay.
Whether or not,
Okay, great. Thank you.
Sorry.
whether or not they're in the compact, or remote state, but they must be in the compact.
Right, remote state in the compact. Right, remote state in the compact where they don't reside.
Okay, and there's no such thing as a remote state not in the compact, because then we're not
Right,
partnering with them.
right.
So the concern that some folks have with interstate compacts, colleagues, is not sufficient oversight, not sufficient accountability, possibly what is called in some contexts sort of pass the trash. Someone does a terrible job or commits a crime or something in another state, and then they decide that they want to practice in Maryland as a way of avoiding consequences. And so that's why this bill and this kind of oversight and accountability is so critical. So that's why we want to be asking questions about accountability and discipline.
So are you saying that a compact will prevent the pass the trash practice?
So I'm not expert enough. I can toss this to Ms. Foxworth, but my understanding is that a compact will allow, hopefully, our constituents to have access to healthcare professionals that may be licensed in other states. It may allow our constituents who are the professionals to practice in other states, which is especially important near our border areas, like in Hartford County or like in Howard County or Carroll County. But we want to make sure that that there's still accountability, and we wouldn't want folks to be at risk. So the reason for the compact is to make sure that there's oversight, and we're going to enforce in Maryland just as they would enforce in Virginia or Pennsylvania. Alexis, am I close to getting that right? Is there anything you want to add? And if Senator Lamb is on, if he wants to pipe in, that would also be helpful.
Right, yeah, these are contractual, obligations. So everyone that takes part in this interstate privilege has to fall within the regulations and requirements of the compact. And it is a way to kind of create ease of access for interstate, travelers, active duty, military, et cetera. But for there to be a cohesive format for practice. And as opposed to being under Tennessee's laws and Maryland's laws, which will ultimately differ, they'll have to fall under the umbrella of the compact. And to certain extents, the compact language will supersede state law. And it seems like that's kind of a uniform aspect of these concepts. They have certain provisions where it says if there's a conflict with state law, then this compact takes precedence over it.
Okay. Is that helpful, Senator Ellis?
Very much so. Thank you.
Good. Any other questions, colleagues? Okay. Alexis, we have the amendments that are needed in order to make this compliant and with sufficient constituent protection and healthcare site and all that and discipline.
Yep.
Okay, it seems that. So should we have a motion on SB 183 as amended?
Move favorable.
Thank you, Senator Hester. Second? Okay, I'll second it. And is there conversation, debate on this bill as amended? Seeing none, are we ready to vote? Senate Bill 183 as amended, please raise your hand if you support this. I see 2 hands up. I see 3 hands up. Senator Lamb has just given us.
Madam Chair, I'm still kind of working through this. I'm not gonna vote up or down. I'm gonna abstain on this one. Just want to look at.
Okay, and Senator Ellis?
And I want to do the great minds with my colleague, Senator Gallion. I need to process some of these terms and before I actually cast a vote. So I want to abstain on this and hopefully by the time we go to committee, we answer.
Okay, so then the subcommittee would report to the full committee, Ms. Foxworth, with a vote of 3 to 0 to 2. And then hopefully our colleagues will either have questions, amendments, or decide that they are ready to support the bill as amended in full committee. Are we good? Any other work for the good of this subcommittee? Seeing none, Ms. Foxworth, are you good?
I'm good. If there are any additional questions on SB 183, any materials that I can kind of draft up and present, happy to do that for full committee vote.
Thank you. Just one question. You need 9 other ones. I'd just be curious if what other states are moving along in this process. Like if 2 have already passed, if there's any way to find that out, that'd be some interesting.
Sure.
Great. Okay. All right. So, and Ms. Foxworth, the full committee is going to be voting on Wednesday, correct?
Yes.
And
Yep.
all 3 bills will be on that voting list. Presumably.
They sure can be.
Okay.
Yep.
Colleagues, is there any reason we shouldn't be ready to vote as a full committee on Wednesday? Because I think the chairman is looking to move items to the floor. Okay.
Yeah. So, Madam Chair, I'll be ready if I get that follow-up information. Hopefully, if you could send it to me, Ms. Fox, before, like the questions with the current membership. And I'm particularly interested in the pass the trash. If this really will fix that problem, I need to kind of solidify that in my brain to make sure we're not making it easier for a subpar person to move from state to state.
Right.
And Madam Vice Chair, I don't know if you can provide that information to us, since you kind of dropped that in my brain.
Yeah. Oh, that was a mistake then for me. I don't. an issue that may not exist at all. It's just that complex sort of raised that issue. Senator Lamb, is that anything that you can speak to briefly? The whole concept of pass the trash and sufficient oversight and discipline for practitioners in other states?
I mean, I think the state generally enters into reciprocity agreements after they've looked at what the standards are. So, I don't think it's I'm hopeful that it's not just an issue trying to pass the trash around. I don't know if Mr. Dudzig's not on here anymore, but maybe can speak more towards, these types of agreements that are in place between the states.
Okay. All right. So we'll get that information, Senator Ellis, and anyone else who has thoughts or questions, please contact Ms. Foxworth, who's doing a great job for us on these issues. So thank you, Ms. Foxworth. If there's nothing else, I think the subcommittee can adjourn. Okay. All right. We did it in an hour, you guys. Good work. Thank you very much. Take care.
Thank you.